Welcome to today's Medicare 360 show. I'm your host, Jennifer Alfonso Lee, and today we are going to deep dive into the gateway strategies from oral health to total vitality. If you didn't join us last week, we did a deep dive into what and how of dental plans, comparing HMOs and PPOs, the missing tooth clause, waiting periods, big players like Aetna, Emeritus, Delta Dental, Manhattan. But today we're shifting our gears to the why. Why am I so obsessed with your teeth? Time and time and again. This is what seniors do have issues with. And just lately, in the past month, I just been helping a lot of seniors with this. So I did want to touch upon it again. Okay. Because in 2026, the medical community is finally admitting what we all have known all along. Your mouth is not an island, right? It's the gateway to your entire systemic health. What we're looking at, definitive new data linking periodontitis, that's chronic gum disease, to a host of big ticket Medicare conditions. We're talking about, say, a 20% increase in cardiovascular risk and a terrifying link to cognitive decline. Research in late 2025 and early 2026 has found that the bacteria P. gingivalis actually presents in the brain plaques of Alzheimer's patients. This isn't just about a white smile, folks. This is about brain preservation. And just the biggest thing is on this, I just have seen many, many more clients being diagnosed with Alzheimer's and dementia. So, and it is very near and dear to my heart with my family as well. So, if you are ignoring a bleeding gum, you're essentially ignoring a slow leak in your body's inflammatory defense system. Even for me, I get my teeth cleaned every 3 months just because of that inflammation. So let's talk about bidirectional trap, diabetes, and inflammation. And I know, I am a health insurance broker and I'm talking about health. So these are just kind of my learnings being in the industry, seeing what goes out in people's health. So that's why I wanted to talk about it. So let's talk to diabetes for a second. This is a bidirectional street. If your blood sugar is out of whack, your body can't fight oral bacteria. But here's the kicker. If your oral bacteria is out of control, it triggers systematic immune response that actually spikes your insulin resistance. And it's a feedback loop from hell. You cannot effectively manage your A1C if your mouth is a war zone. That's the thing, right? Like I see so many clients being diabetic or pre-diabetic, having to take prescription medication. So I think this is something that isn't talked about. So, I mean, if anything could help you with your health so you could have a better lifestyle and live longer, then why not, right? Like I mentioned, I'm not like a health or medical field per se, and I'm on the insurance portion, but the it's good to know, right? Like even for me, it's like I don't know anything. Rely on your doctors, but also take that proactive stance and knowing your body and things as well. Okay. Um, so recent analysis show that seniors who consistently receive periodontal maintenance, that's your D4910 code for those taking note, see a 40% reduction in hospitalizations for heart disease and diabetes. And I'm telling you, heart disease and diabetes is probably the two top chronic conditions I see in patients and seniors. And also, I mean, plans are specifically gearing their plans or creating plans for diabetic or heart condition patients. So let's think about this. A $150 cleaning could be a reason you avoid a 15,000 hospital stay. This is what I call a biological rate of investment, right? If your current Medicare Advantage plan cut your cleanings down to twice a year and you have gums disease, you're underinsured, period, right? Yeah, if you notice, most insurances only cover two cleanings, two exams per year. But if you're prone for inflammation or gum disease, then I would definitely spend that extra money or get extra insurance to do this. I mean, sometimes people think, oh, not a big deal, but yeah, your teeth could be the gateway to your health. Okay, 1 second. Let me take a drink of my coffee. So let's talk about the Part B loophole on dental, right? Because when most of the time, when you go to the dentist, you say, I have Medicare, usually your dentist will say, Medicare doesn't cover dental, right? That's like the bust a myth. Everyone says your dentist says, "Oh, well, you don't. Your dental is not covered by your Medicare, and that's that." Okay, so that is like a lie by omission, but I mean, people don't know, right? Because the terminology that, say, a dentist use in their coverages is not like they're not trained, or most of them are not trained to be like, hey, Medicare does may cover it. Okay. So, Medicare will pay for dental services that are inextricably linked to a covered medical procedure. So, example, let's just say you schedule a heart valve replacement at Cedars-Sinai or a kidney transplant at UCLA. Your surgeon needs you to have an oral exam to ensure there's an infection. There's no infection, I mean, that could cause a surgery to fail. That exam and any extractions needed to clear that infection should be covered under your Part B medical benefits. Do not let a billing department tell you to pay out of pocket for clearance exam. It's an integral part to the success of the medical surgery. It's a medical benefit, so use it. So keep in mind, if you are on a Medicare Advantage, your coverage might be different from a Medicare supplemental plan. If you are on a Medicare supplemental plan, your doctors need to bill as a covered medical procedure, right? So they do need to know how to do that. Some dentists I do know how to do that, but medically necessary, right? If you are on a Medicare Advantage plan, then it may be different. So contact us, contact your carrier, see what you could do with that. Because there is a dental portion, maybe a dental portion in your plan, but you do have to check your summary benefits for that. Okay, so just to recap on regards to dental not being covered by Medicare on a supplemental plan, it is through medically necessary. And then if you have an Advantage plan, you do have to look at the particular coverage you do have, just to make sure and ensure that it is covered or not covered, and not all plans are created equal. Every insurance company has their own vendor they use as well, and their own set of summary benefits or evidence of insurance that you want to look at. So Let us talk about the 2026 directory dupe SEP and like the PPO exodus, particularly in Southern California. So let's get tactical. 2026 has been a reset year for the SoCal market. We've seen what I call the PPO exodus. Major carriers like United Healthcare and Blue Shield have slashed their PPO footprints in LA and Orange counties, funneling people into HMO to manage rising costs, right? So if you stayed in a plan that transitioned from a PPO to an HMO, this January your role just got very small, right? Suddenly your favorite dentist or that specialist you've seen for a decade out of network is no longer to be seen, right? And then just to touch on that, on Medicare Advantage plans, sometimes you do have the Medicare Advantage Medicare portion that would be HMO, but maybe your dental portion is PPO. I know it gets quite confusing, and I do have to explain to clients how all this works. So you're not alone. Please definitely give us a call if you need help on that. Okay. So the breaking news for 2026 is Center of Medicare Services has officially launched a temporary special enrollment period for provider director inaccuracies. So this is huge, okay? So if you use the Medicare Plan Finder on Medicare.gov to pick your plan, and the website told you that you and your doctor was in network, but you show up and the front desk says, we haven't taken that plan in 3 years, you're not stuck, you have been directory duped. Okay, and so that's the biggest thing, right? I know you could be the savvy senior that definitely goes online, goes to Medicare.gov, finds a plan. Okay, but not everything you see written in the internet says a lot in the plan, right? So using a local broker like myself, I'm able to let you know the different happenings, the different updates, just what's going on in the industry and the carriers as a whole, and could provide you and paint you a picture of what's been going on for the last couple of years, particularly, say, with that carrier. The history of the coverages. Are their coverages going down? Are their coverages going up? And like one of the biggest things I would say is dental, right? There was plans that totally just took off their dental. I mean, let's just say they had 3,000 dental, they gave you 200. They changed it to PPO to an HMO. They slashed it. They took off implants. You name it. It gets quite confusing. If you are savvy and you love to do all this, yes, but it is a lot of work to do the research because not everything's online and not everything is accurate. Sometimes you don't know if all your doctors and specialists are in one medical group or even the dental, right? Because there are different dental plans within every insurance company as well. So it is a lot to take in on that. So the nice thing about that is that the rules for this special enrollment period is that if you did enroll in a plan finder and you must be within the first 3 months of your plan enrollment and discover that there were errors in that, you could call and change your plan. Right now is open enrollment period, so definitely we could still help you with that as well. I mean, if Medicare.gov did you wrong, really, why would you call Medicare.gov again to fix your problem? Call us and we could figure it out for you just so you get that second opinion, that second choice to see, hey, am I making a right decision? Because sometimes a client, they meet with me, of course, they did all their homework. And then for some reason, they didn't see a plan that they could have qualified for. And it's like, hey, this plan is way better for you than the plans that you saw online, just because like you didn't click on a button and you didn't see all plans, things like that. Time and time and again, we definitely have you in our corner, have your back, and definitely will give you all the details on that. Um, so that is a special enrollment period. But today, you do have less than 48 hours in the last, well, tomorrow is the last day of the month, to figure things out for open enrollment that closes March 31st. So if you are in a plan you hate, you have until tomorrow at midnight to make one final switch. If you miss that window, you're locked in for the whole year unless you have a special enrollment, move like counties, or like maybe have a chronic condition such as diabetes or heart condition or Medi-Cal. But of course, we could help you with that and figure it out for you. What I also wanted to address is the vitality dividend exercise and metabolic strategy. So let's talk about free money, or what I call the strategy section. It's like the annual wellness visit hack. So every senior on Medicare gets an annual visit at $0. And, some insurance companies or medical groups even actually pay you to get your preventive or your annual wellness earlier, earlier on the year, right? So, hey, go and get paid for it. So the mistake most people make is treating it like a physical, and it's not a hands-on exam. It's a mapping session. This is where you demand your screening roadmap. So if you're active, if you're hiking the trails of Malibu or the San Gabriel Mountains, you need to talk about bone density. Medicare covers DEXA scans every 24 months for at-risk beneficiaries. If you've ever been a smoker, you're entitled to a low-dose CT lung scan screening. This is $0 out of your pocket, but this is the difference between stage 1 and stage 4 disaster. Use that visit to audit your prescriptions too. Is your blood pressure meds causing dry mouth? If so, they're rotting your teeth from the inside out. So ask for a medication review. So the biggest thing, again, between a stage 1 and stage 4, is having the right medical providers, I would say too. Preventive and catching things early. But what breaks my heart is when people do go in and they're misdiagnosed. The doctor can't figure it out until it's too late. So at that point, I would definitely get second opinions to other providers, right? To other medical groups, because it is your health, it is your life, and it's unfortunate. Some doctors may get it wrong. And I've known cases like that too. So keep that in mind. Do you also want to talk about the 2026 diabetes prevention revolution? So let's talk about the Medicare Diabetes Prevention Program. Huge update for 2026. This is no longer a once per lifetime benefit. So if you are pre-diabetic, you can now access this year-long coaching program multiple times. If you haven't reached your health goals, it is now available virtually, which is great for SoCal traffic, and it focuses on HIIT training and dietary shifts. Of course, make sure if you are in a Medicare Advantage plan to make sure if this is covered or if they have something similar for that, or if you are in MedSup, should be covered as well. So the data is undeniable. If you lose just 5% of your body weight through this program, your risk of developing type 2 diabetes drops by 60%. Think about your Part D donut hole. Think about the cost of insulin. Well, technically, you don't have that Part D donut hole, right? So the donut hole did go away. Your max out of pocket is $2,100, but just in case a drug is not covered, right? So think about insulin costs. Well, insulin cost is $35. It could still add up for you. Reversing prediabetes is the single best financial investment you could make in your retirement. That is your Medicare dividend, right? So touching upon longevity, fall prevention. So I wanted to wrap it up by talking about sarcopenia and home hardware. So this is the number one independence killer for seniors, falls. In Southern California, we're seeing 2026 plans lean heavily into environmental lead. Check your over the counter benefits. Many plans now allow you to use those credits for home safety hardware like grab bars for showers, non slip mats, or even motion sensor lights. This is a scary thing. I have seniors fall and slip, hit their head, and then it's kind of downhill. So please be careful out there. But hardware isn't enough. You do need muscle hardware, right? So sarcopenia is the natural loss of muscle mass as we age, is what leads to those falls. Use your Fit On or renew active gym memberships. So that's kind of like your silver sneakers. They're all kind of the same. They're just different vendors, okay? So they aren't just for gym rats anymore. You could go to maybe boutique studios, yoga, and balance training. If you haven't used your gym benefit, you are essentially leaving 1,500 of health value on the table every year. So please, please, definitely go through that. Um, another special enrollment period would be the five-star get out of jail card. There is not a lot of five-star plans in the area, but we could definitely look and help you figure it out if there is something that you could switch on. And the biggest thing is like chronic conditions. There are plans that are diabetes and heart condition plans, lung, mental health, and so forth. Before you were able to just switch once a year, but now I believe you could switch at all times. So the biggest thing I would say is we talked a lot about dental, right? And sometimes we don't think that dental could be a factor to our body, to our temple. Um, and your Medicare plan is insurance policy that keeps it all standing. Make sure you understand all your benefits in your plans. If you are on a supplemental plan, make sure you understand like what is available. There is an app you could download that shows what's covered through Medicare. If you are on a Medicare Advantage plan, just make sure you know your coverages as well and like the vendors that you could use. Inflation's high, things are tough, things, benefits are going down. So the more you know about your plan and figure it out, would be definitely good for you. So open enrollment period does end March 31st. Remember, like agents or call centers or insurance companies cannot reach out to you to say, hey, we could change your plan. That is non-compliant, not supposed to happen, right? The calls that you should get are the ones that you requested, right? So keep that in mind when that it is questionable because seniors every single day get phone calls without their solicitation. And then they are confused. They feel like I'm not covered. This person scared me to change my plan, and it just really messes them up. So here at Premier 360, we do help with that. Please give us a call, and we're your advocate to help you figure it out. It's it's not that easy sometimes for coverage, benefits, wrong billing, mistakes, errors, and we are here to help you. So my name is Jennifer Lee with the Medicare 360 show. Thank you for joining us today. We look forward to seeing you next week. You have a wonderful day. Take care. Bye bye.